I'm the chair of the board of the Alliance for Health Policy and Systems Research, and I've been a member of that board since 2001. And in many ways, we are a sister organization of COHRED, and we've been at least in the same space and advocating for the same issues, more investments, better investments in research for health. Yeah, so the main theme of the colloquium, at least the way I read it, is the need to increase investments in health research. And I'm in particular concerned about all countries understanding their responsibilities regarding increasing investments. And that should be countries across the income spectrum. So both high-income countries, middle-income countries, and low-income countries should have at least a core domestic investment in health research. And I think that core is necessary as a platform to engage potentially external funding as well. Okay. And I hope that we gradually can establish some sort of norms and principles regarding those issues, so that all countries can contribute to essential health research. Yeah.
Okay, great. I mean, one of the, just following up on that, one of the areas that has sometimes been talked about and raised, and sometimes not, at the country level, is the role of the private sectors in those countries to boost investments, and and for them to do that, there sort of has to be a profit sort of orientation for them as well. Your thoughts on that? Your experiences in terms of the work that you do with the private sectors in those countries?
Yes, I should say first that there's kind of my main interest have been health systems, health policy research, and there's less of a kind of profit potential in that area. It's definitely a responsibility of public entities and governments. But having said that, I think we need to make kind of both on the system side and on the delivery of technologies, we need to make a space for private sector, and private sector companies also doing research within low-income countries and establishing companies out of low-income countries. And I think that's actually one of the necessities for having sustainable delivery of health technologies that are adapted to and affordable in low-income country setting, is to actually do more of that development in low-income country settings. COHRED was, of course, originated out of the Commission on Health Research for Development, more than 20, or that was a 1990 report, and then the council was established in 1993. I think the main issue then was capacity for essential health research in countries. I think COHRED, as a civil society organization, is well placed to both challenge national governments in countries regarding investments in health research, but also challenge the international community and global organizations, either private or kind of World Health Organizations, regarding the need to invest in proper ways. And I think the added value of COHRED is especially having that civil society voice, kind of being on the side of countries and country capacity, but at the same time challenge in both directions.
Brilliant. Thank you very much.